Hello, my name is Dr. Zachary Ward. I'm speaking to you today from Ames, Iowa. I am an upper cervical chiropractor. This is my video blog. I answer your questions about chiropractic care in general and upper cervical chiropractic care in particular. This video blog post is about headache. I often get asked about headaches. Chiropractic is often known to be good for headaches, and of course there are many different kinds of headaches. We have migraines, we have tension headaches, we have cluster headaches, we have headaches that involve certain parts of the nervous system and headaches that don't. And their diagnosis can be difficult and sometimes controversial, and it is not uncommon for people to kind of go through the healthcare system a long time without actually finding an answer for their headaches. And there's really good reasons for that. And one of them is, in fact, that rather than having a headache that actually starts in the head, they're having a headache that starts in the neck. And they're having a cervicogenic headache. So I'm going to tell you about cervicogenic headache, why we think it's happening, what treatment options are out there for people who are experiencing this, and then of course what we do as upper cervical chiropractors in order to correct the cause of what we believe is causing the cervicogenic headache. So on the screen in front of you is an image of the top of the spine. I'm going to move the cursor over. We have the first cervical vertebrae right where the arrow is. We have the second cervical vertebrae. We have the third cervical vertebrae. And this concept of the cervicogenic headache has been talked about in chiropractic for a long time, perhaps osteopathy as well. However, it hasn't always been recognized by everybody in medicine, and that is because they couldn't seem to figure out what the definitive reason was. There might be pain in the head coming from the neck. And while there are other reasons, this is a really strong argument. What you're seeing in front of you is a picture of a connective tissue bridge from the back of musculature from the back of the head, muscles involved with balancing and the motion of the head, connecting to actually the spinal cord, the dura, or so a sheath over the spinal cord at the back of the head. So this connective tissue bridge was discovered in the mid-1990s in Baltimore, and here was one definitive reason anatomically why a headache could be in the head, but actually start in the neck. Of course, muscles can also refer pain up to the head, so you could have problems in the musculature that go up to the head. You could have problems in the blood vessels that go up to the head. You could have problems within the nerves in the neck that go up to the head. So there can be many different reasons for cervicogenic headache. The main idea is, of course, it's starting in the neck and going to the head. And the best way that I can illustrate this is actually looking at a treatment option that is within medicine where they actually inject painkiller into where but the back of the head and the top of the neck. So let's go ahead and take a look at that research right now. So we're going to give you the Reader's Digest edited version of this, but this is called Upper Cervical Facet Joints and Spinal Rami Blocks for the Treatment of Cervicogenic Headache. So headache that begins in the neck, treatment for headache that begins in the neck from what they call spinal rami blocks. And spinal rami blocks just basically means that they're shooting painkillers or something that's blocking nerves from firing at the spinal rami, so the branches of the spinal cord that are coming out at the top of the spinal cord. Upper cervical facet joint just refers to upper cervical, referring to the top of the spine. Facet joint is where the spinal bones come together. So if I point this out on my model, it's going to look something like this. Here's the back of the skull. We have the top of the spine here, the C1 vertebrae. We have the C2 vertebrae here. The spinal rami, it's these little guys kind of poking out here. So they're actually injecting a painkiller into the skin to stop nerve conduction from the back of the spinal cord that goes back up into the head. And let's explain why. You actually have a lot of nerve bundles in close proximity to how these joints come together at the top of the cervical spine. So this is that first cervical vertebrae, this is that second cervical vertebrae. They work in kind of a peg and socket system. So as there's a problem with their alignment, you get some garbled information that ends up affecting how the nerves are firing, and they end up firing, we think, more often than they should be, and end up causing pain into the head. Okay, and our picture's back up. So you really have a couple of treatment options if you're dealing with something like this. You could cover the pain up, which is what a rami dorsal block is going to do. You could take painkillers, antidepressants are prescribed, or you can deal with the mechanical dysfunction that is causing it, and that's what we do with chiropractic.